Hi, my name is Kenny Henwood, student 377636. Due to a broken foot, all of my assessment today will be completed on the floor due to me not being able to weight bear. Now, while I understand that this is not ideal and that ultimately we would be on a table and that if this was an injury in real life, then I would be unable to complete it. However, we do need to complete it on the floor for this assessment. Not ideal for back straightness during any assessment. However, this is how it will need to be completed. So today we're going to be doing a muscle movement test. This is for SPE262. 262 for functional anatomy. We will be completing this with my client Darcy. She has both written and verbally consented, and due to the fact she's under 18, we have also received consent to be filmed from the parents. We'll be going through each muscle separately. The reason we do this is to ascertain whether the muscles have weakness or an injury or are shortened. This can also help with neuromuscular identification of issues that may have occurred, such as example, a stroke or something like that. Muscle testing is very important, as we don't want any other joints and muscles overcompensating for a muscle that's not working properly. This also gives us a baseline to work with when we start doing interventions, so that we know where we're working from. So this muscle test today will be completed on the adductor muscles, on the pronation muscles, and on the big toe muscle. So that's what we'll be working on today. Okay, so we're going to do this exercise on the ground purely because I have my own broken foot. So first of all, we're going to start with hip adduction. So your hip adduction is the muscles that keep your legs inside, so they keep it all in line. It's the one that kind of brings your leg back towards the midline of your body, which is the middle. So they are the pectineus, then you have the adductor brevis, which is the small one, adductor longus, which is the long one, adductor magnus, which is the big one, and then we have the gracilis, which is the small one down the bottom closest to your knee. So they're all the 5 muscles that kind of bring your hip back into place. Now, we're going to start with warming up a little bit before we do the muscles. Now, what I would like you to do, now Darcy, I know we went through this at the start, but do you consent still to me touching you?
Yes, I do.
Beautiful. So for our warm up, we're just going to gently, not aggressively, gently bring up your knee to here. And then we're going to open the gate out and then slowly bring it back down to that neutral position down here. And we're going to do that 3 times just to warm up those hip muscles.
On each leg?
On each leg, yep. So bring it up and then out and then down. And one more on that side. That's okay. One more and then out and then down. Beautiful. And now on this side, up and then out and then down, up and then out and then down and up and then out and then down. Perfect. Okay, so for this test, what we're going to do is I'm going to get you to roll onto your side. You don't have to do it yet. I'm going to hold up the leg closest to me. Under my thing, my hand is going to be located just above your knee, holding that leg separate, and your bottom leg is going to be laying down. Now what's going to happen is I'm going to ask you to push against my hand as I push against your thigh, not your knee. So what we're going to do is just test how good that muscle is when I put a bit of pressure against it, just to see that it's all working.
Okay.
So we need this muscle in our hip. It's really important because it helps with balance. It helps with all those big movements that we do with our legs, and if our legs aren't working, that actually affects a lot of things in our life. So we really need these big muscles. Any abnormalities can make back pain, groin pain when you're running and moving, and lots of things like that. So are you ready to complete the test?
Okay.
So roll over onto that side. Now I'm going to put my hand on the inside of this thigh here. All good. And I'm just going to gently hold it up here so it's protected. Then what I'm going to do is I'm going to ask you in a moment to lift this one up as I'm going to push against here. Now I'm going to push on your thigh, not on your knee, okay?
Okay.
So, ready, go. and relax. Beautiful, you did really well. How does that feel? Everything still feel good?
Yeah, I feel okay.
Good work. All right, now I want you to roll back towards me on this side. And we're just going to test that both your legs are working really well. So this time I'm going to hold this one up. Perfect. And I'm going to push against this one. Are you ready? Go. Good job. Now you can lay flat on your back again. Now, did you notice any difference between your legs?
My left one was a bit harder to do.
Yeah.
And more dominant in my right leg.
Yeah, and that's it. We'll always have one that's a little bit stronger than the other. But thank you very much, Darcy. You were really helpful, okay?
No problem.
All right, thank you. The adductors or the hip adductors are a ball and socket joint. Very similar to the shoulder, however, unlike the shoulder, they are more secure, more stable, so that decreases their range of motion slightly, but also less likely to dislocate, so that's a plus. Common errors when completing the hip adduction test would be pushing on the knee or not holding the other leg stable. Needs to be out of the way. The pushing on the knee can cause pain and also incorrect muscle placement. Also could be flexion during the knee during the test, and tilting of the lower back. This can give a different reading and how much pressure. If the adductors are shortened, so if they aren't in the normal range, then that's required for movement, so this can affect your gait, so your walk can be out, which can cause knee pain, ankle pain, lower back pain, mainly the knees and the lower back. It can also increase like medial stress in those knees, all of which will be affected if the adductors are not working correctly. Okay, Darcy, so you consent to me touching you again?
I do.
Beautiful. So now we're going to be testing your flexor hallucis brevis, which is your big toe muscle, the little one down here. So it is the muscle that controls your big toe, and it goes across your metatarsal phalangic joint. Okay?
Okay.
So what we're going to be doing is we're going to be holding your foot up like this. But first of all, we're going to do a little warm up. So I just want you to wiggle these toes all around. Any pain, any issues? No?
I feel pretty good.
Yep, beautiful, lovely. So we're going to be putting your foot up like this. I'm going to be putting my hand here to just push some pressure, and I'm going to be asking you, I'm going to hold my hand down here against that joint and get you to move your toe like this. Understand? So you want to put that pressure against me while I'm pushing against you.
And keep it up like this.
Yep, keep it up like that. Ready, go. And stop. Great job. Now, this muscle is very important because your big toe is kind of the push-off point for you walking, running, jumping, things like that. It also helps with balance and so forth. Now, if that muscle isn't working, then it can put extra pressure on your other toes, put extra pressure on your ankle, and it can even make your foot turn in and out as your body tries to balance. And we need our legs and walking for everything we do. Okay, so we're still feeling all good?
Yeah.
Yep, and can we do the other one just to test? So we're going up. Remember how we do it? Yep, so I'm going to put my hand against here, working there, and push. And see if you can hold it down. Push, 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 and release. Great job, Darcy. Thank you very much for your help. The flexor hallucis brevis can be too short or too tight. This can cause a lack of power for that stepping off your toe motion in walking, running, jumping, all those kind of motions. If this is too tight, then that means that, or too short, then that means that you can't extend that big toe properly. So that can cause an issue with walking. It can also increase the likelihood of getting bunions or plantar fasciitis. Also, the ankle has to compensate for that lack of power, so it's having to do more dorsiflexing in the foot, which means that it's being overworked and overcompensating for that lack of ability to put power from the big toe in that motion. Okay, now we'll be looking at the pronator teres and the pronator quadratus. So the pronator teres attaches here and goes along, quadratus goes parallel along the ground, so from there to there. So Darcy, do you consent to me touching you still?
I do.
Beautiful. So we're going to start with the wrist in and the hand in supination. So basically your palm is facing upwards. Now what I'm going to do is I'm going to put my hand on the side of your elbow here and I'm going to push against it. So you're going to be trying to lift it up and I'm going to be trying to push it back. And what we're going to do is we're going to turn your hand over at the start and I'm going to be holding this. So you're going to be pushing your elbow up and you're going to be trying to twist your hand around at the same time.
So like this?
Yeah, and around at the same time. Okay, so we're going to start with your hand about here. So you're going to be trying to get it all the way back to here and push against me as I'm trying to push. So you're going to be going that way and I'm going to be going that way. Understand? Because one of your muscles is going to move that way and I'm going to push against it to see if it works. All right, are you ready? So what are you doing?
I'm trying to bring it back here while I'm pushing against it, and I'm trying to turn it at the same time.
So you're basically trying to that way. Okay, you ready? Steady, go. Great job. And how's that feel? Any pain or anything?
No, it felt pretty good.
Awesome. The pronator teres and the pronator quadratus. So the pronator quadratus is the pronator that when contracted it pulls the radius over the ulna. The pronator teres, when contracted, creates some elbow flexion and assists with that pronation. So ineffective pronators would create a lot of compensation in the wrists, the elbows, the shoulders. It can even cause issues with the golfer's elbow and so forth. You also find a lot of people when they're writing or doing fine motor activities, if they have these really tight pronators and really struggle between the movements of pronating and not, that they'll overcompensate with their shoulder and it's almost looking like a chicken wing sticking out because they're using those shoulder muscles as opposed to using the pronators correctly. So that can lead to a lot of compensation through that. The first muscle tested as part of the hip and knee is the popliteus. So the popliteus is the little muscle behind the knee that helps get it out of full lock. We use it when we're slightly moving in motion. So with the exception of running straight, it's used when we basically change direction while moving. Or even stop suddenly and so forth. So that needs to be working properly. To test it, the person sits down, the knee is bent at a 90-degree angle, and then the tester is pushing inwards so that the foot is trying to go towards the midline while the muscle pushes against it. So we're putting pressure in towards the midline and they're putting pressure out. And we're basically checking that there is some pressure against our pressure. Next, we look at the semimembranosus and semitendinosus, or basically the hamstrings. The way to do this is to have the client laying down in prone, so on their stomach, have the tibia and fibia at about a 60-degree angle off the table, and then have it bending slightly inwards, and then apply, so holding on to the hamstring muscles with one hand, and then slightly apply pressure to try and bend the tibia and fibia down with a slight bend and see whether there is pressure against it. The next test is on the quadriceps. The main role of the quadriceps is to extend the knees straight. So with this test, the client would lay down on the table up to about their knees with their shins laying over the edge of the table, and then they would try to straighten their knee and extend, while the SSR pushes down on their shin, and that is how the pressure test is done for that muscle. Next is the iliopsoas test. This is basically to test hip flexion, so whether the knee can come up towards the chest. So in this one, we get the client laying on their back, lifting their knee up, and then basically we're putting pressure back against their knee down to see whether their flexion has enough pressure to go against our pressure in a downwards motion. Next we have the sartorius, which is the flexing, the abducting, so moving away from the body, and the rotation of the hips. So we use this when we cross our legs on the ground. So with this one, the patient is lifting their leg and they're bending their knee and moving it outwards with their hip. The tester is then pushing in the opposite direction to see whether they can take the pressure of that one. After that one is the tensor fasciae lat, or the TFL. So that is the muscle that pulls the leg out to the side and helps rotate it inward, which helps in that kind of spinning motion, so, and changing direction. So the client would lie on their back with their leg lifted out to the side, turn slightly inwards. Then the tester pushes down and inwards to see if they can put pressure against it. After that one is the hip adductors. So adductors, moving the hip inwards. So the client would lay on their back and they would be trying to bring their leg inwards while the SSO is trying to push their leg outwards without putting pressure on their knee. And they would lay on their side and do that one. So while cradling the more top leg, they would cradle that one, try and bring their leg upwards. At the same time, the assessor is pushing downwards for pressure and then swapping sides. Next would be the hip rotators. Now, the hip rotators are the medial rotator and the lateral rotator. So one is turning the thigh inward, the other is turning the thigh outward. So sitting with their knees bent, the tester pushes against the ankle to resist rotation. Again, making sure that we're pushing against the muscle and not putting the ankle in an unnatural position. And finally would be the glutes. So the gluteus minimus, the gluteus medius, and the gluteus maximus. So these are responsible for moving the leg sidewards in abduction, so away from the body. Moving the medius would be moving it sidewards with a slight hip rotation, and the gluteus maximus extends the hip backwards, as well as keeping the hip and everything stable through there. So to complete this test, we're doing it face down and the tester pushes the opposite. So with the minimus, they're trying to push the leg inwards or in adduction, while the muscles are trying to put outwards. Medius, the leg is moving sideways with slide and pushing the opposite direction, and the maximus is trying to push the leg forwards to see whether the maximus is helping it move backwards. So that's how to complete these tests. So basically using the scaling system, if they can move these muscles in the position required properly against gravity, it is a 3 out of 5. If they can do it with good pressure and hold it for a reasonable time, usually around 3 to 5 seconds, then they would be out of 5 against the testing, and that is ideally what we want all the muscles at, is a 5. Thank you.